This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, good morning, everybody. So I was going to talk a little bit about push-dose pressors. It's something that we use sometimes here when we have someone who's hypotensive and we don't have time for fluids or blood or to hang pressors to try and improve their blood pressure, whether it's because we're getting ready to intubate them and we know their blood pressure is going to drop even more, so we want to get their blood pressure up safely, or because we have to get them over to CT and we don't have time to hang the pressors or, like I said, wait. So, there's two kinds of pressors that we typically use for push-dose in general. Here, we use push-dose phenylephrine. There are other places that use push-dose epinephrine as well. There's not a lot of good data about these in the emergency department. There's been a lot of time that they've been used in the operating room and a lot of data on that. But there was a recent study that looked at them being used in an emergency department and kind of compared the phenylephrine and epinephrine in terms of effectiveness and safety. And it found that they were both pretty effective. Push-dose phenylephrine raised people's blood pressures by about 26 systolic, and then the epinephrine was a little bit better, raised it by 33 on average when used. But either one of those seems pretty effective to get the blood pressure up by 26 or 33. Interestingly, dosing errors, which is kind of the big thing that we'd worry about, were much more common in the epinephrine. About 13% of the time with epinephrine, or only 2% of the time with the phenylephrine. And this is when they already had premixed syringes like we do here. Not a lot of bad outcomes, or no bad outcomes really, from those kind of dosing errors, but it's something to think about. So overall, it was a pretty safe and effective practice when used in this emergency department where they studied it. Just as a reminder, we have push-dose phenylephrine here. It's premixed. The doses is 50 to 200 micrograms of phenylephrine, or 0.5 to 2 mLs. But the easiest thing is just to push 1 ml at a time, wait for, see if a response, and you can give more kind of to titrate for blood pressure until you can get either blood pressure improved with treating the underlying cause or getting a pressor drip going. So any questions or comments? All right, thanks. Good morning.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.